Sometimes you just gotta believe.
Hello guys, welcome back to my channel. My name is Dele. I am a Nigerian YouTuber based in London. Welcome to my channel. If this is your first time seeing this beautiful face, don't forget to like, share, subscribe, all of those good stuff. So let's go straight into today's video. I am dressed for today's video. I thought let me just show you guys what a nurse practitioner would look like at work. Although for me, this is not what I wear to work. I don't get to wear scrubs or use my stethoscopes. But it depends on what settings you want to work at or will determine what you wear to work. Before this current job I'm currently working at, I used to wear this particular scrub and use the stethoscope at work. So guys, I'll tell you all about the different pathways on how to become a practitioner. This is for those based in the UK. For those that are not aware, in the UK, there are different pathways. We have the Advanced Nurse Practitioner pathway, or they called Advanced Clinical Practitioner pathway. We have the Nurse Practitioner pathway, and we have the Urgent Care Practitioner pathway. I currently work as a nurse practitioner because I have not completed my MSc in advanced clinical practice. So I am not an advanced nurse practitioner, I am a nurse practitioner. Explain the different pathways. I should have completed this course by now, but life has been lifing. I'm supposed to continue with the MSc program this September, but unfortunately, I don't think so. Well, I don't think so, to be honest. I've never even applied, so I don't think so. I don't think I'm ready mentally, and the other things I'm doing. So I really want to focus on that. Then hopefully in January, there's some universities that have a January intake that I would, by God's grace, apply to continue this master's program so that I can finish with it and be done with it. We're done with education, But yeah, so guys, I will explain to you the different pathways on how to become an advanced nurse practitioner or a nurse practitioner like me or urgent care practitioner. I'm going to start with the advanced clinical practice, short form of ACP. And the reason why I say advanced clinical practitioner instead of advanced nurse practitioner, because for this program, the ACP, which is the advanced clinical practitioner, they are not just nurses that are called advanced clinical practitioners. We have pharmacists, we have paramedics, we have physiotherapists that can also apply to become an advanced clinical practitioner. And that is why it was changed from ANP to ACP. We are now called, or they are now called, advanced clinical practitioner. But for me, I am called a nurse practitioner because I have not finished the whole master's program and I am a nurse. So I am a nurse practitioner. And I'm going to first talk about the requirements. Every university requirement is different. So it depends on what university you want to study at. So it's better for you to search that particular university, maybe based on the one closer to home for you, or closer to where you work, or closer to where you trust, because which university your trust has a collaboration with. You obviously have to have completed your first degree in a health related subject. For example, a BSc in adult nursing or in mental health nursing, physiotherapy, your pharmacist. That's the first requirement. Also there are other requirements. Next requirement for you, at least 3 years work experience post your degree qualification. The purpose of this video, because I said there are different type of healthcare professionals that focus mainly on the nursing part, because I am a nurse and I don't want to keep going all over the place, so it makes sense. But if you are, for example, your physiotherapist, you're watching this video, you can research more about the requirement for you as a physiotherapist. If you're a paramedic and you're watching this video, you can do research on what is required for you as a paramedic. For me as a nurse, for example, I should have worked at least 3 years post my degree qualification before I can apply for this course. 7 years now I've been working as a nurse. And then the other requirement is obviously you have your GCSEs, which you already would have attained before you studied to become next requirement is for you to be registered with the statutory regulator for your profession. For example, for me, I am a nurse, so I the requirement for me to be registered with the Nursing and Midwifery Council, which I am. So that's the third requirement. And then the fourth requirement is, most instances I researched about before doing this video. They want you to be a permanent staff because they want you to have the support of your trust now for you to apply for this course. Don't forget to like, share, subscribe. Also, now for you to do this ACP, because some people apply for a job role called trainee ACP, where you can go to uni 1 day a week, and then the remaining 2 days or 3 days you will work at your setting. For example, if you work in A&E, you do your clinical hours in A&E to get obviously your competencies, to improve your skills and your knowledge on how to become an advanced care practitioner. Like I said earlier, I know of colleagues that have completed this ACP pathway without working permanently for any trust. They work as an agency, but obviously it was very challenging for them to find the right university to accept them, and also to find a supervisor, because when you're working, like we all know, before you become a nurse you have to have mentors. So while you're also working as a trainee ACP, or you're working to complete the ACP training, I want you to have a clinical supervisor to help supervise you while you're training to become an advanced clinical practitioner. And that's why some universities would not accept applications from professionals that don't have a permanent contract with the employer. Requirement is they want you to have an employer to be the one to recommend you for this course. The trust I used to work for, you have an interview with the lead for clinical practice, and if you pass the interview, your name will be put forward to the education department of that trust, and you'll be eligible to apply for this course at the university the trust has a collaboration with. So I said the other ways, you just have to do your research. I know colleagues that have been able to complete this pathway without having a permanent contract with any 3 to 5 years to complete this course, depending on your circumstances. It's taking me how many years now? I don't even want to talk about it, but I'm going to finish it soon. If you get the recommendation from your trust that for you to apply for the ACP pathway, you wouldn't have to pay for the course, because you are going to be working for the trust while you're completing your program. The employer will be sponsoring you to study to become an advanced clinical practitioner. But obviously at the end of the program, there are requirements that you have to work for the trust for another 2 years or 3 years. I am not sure, but do your research before obviously you can leave the trust, because obviously they've paid for you to become an advanced clinical practitioner. Or you have to pay back a lot of money for you if you want to leave the trust before completing the 2 years contract after you finish the ACP program. There are 180 units that you must have completed by the end of the program before you can complete this master program. Compulsory modules that you must complete, and there's some that you can decide which modules you want to complete. The 3 to 5 years, you've completed 180 units and you've passed all your exams, all your essays, all your competencies, then you'll be qualified to become an advanced clinical practitioner. Even before you finish the module, you already get a job, because most of these applicants are sponsored by an employer. So obviously we'll have a job for them at the end of the... We're going to talk about the course. Nurse practitioner pathway. I am a nurse practitioner. I am not an advanced nurse practitioner because I have not completed the whole program, because I've only done few modules. So I'll explain. So for me, and this is another pathway if you're interested, you can either go through your employer. I started with individual modules. So I first completed history taking and physical assessment module. It is 15 unit module. That was a 3-month program, which means you take history from the patient and do the physical assessment on the patient. You can do more research about that online. I will leave it on the screen. And I finished the first module. I went on to the second module. I did the minor illness and diagnostic, I can't pronounce the word, diagnostic module. I'll put it on the screen. It was also a 3-month course, 15 units I got at the end of it. Finished the second module. I also then went on to non-medical prescribing module. That is a 6-month module. I did it online because I done it during COVID, but I think they're still offering face-to-face university you want to study at. But 6-month module for 30 units, and I gained 30 units from it. I'll leave it on the show. I think it was 30 units. At the moment, I have 60 units that I've only completed. I have 180 to complete to finish the whole master's program. So I still have 120 to go. But it is doable, but that means I have like 2 years. If you think about it, I have 2 years to go to finish it. But I am going to do it. I am going to complete it. But life has just been lifing. But yeah. So I have completed these 3 modules. So because I've completed these 3 modules, I am able to work as a nurse practitioner. You don't want to finish your own master's program, you don't have time to finish it, or you don't want to do it now because obviously life is lifing. You can, these 3 modules, it's going to take about a year plus to finish these 3. I've completed the nursing practitioner pathway. But some employers would take you even if you haven't done the non-medical prescribing. For me, I've tried to apply to some universities to finish the modules. They've told me I will get some modules off because I already have some modules already completed. So I'm not going to redo the modules again because I'm still currently working as a nurse practitioner. So I'm still using the skill and the knowledge on a day-to-day basis. So some universities are willing to take that modules off the 180 units requirement, and then I only have to complete 120 units. But you have the conversation with the university and they will tell you what the requirements are, if you meet the requirements, or if you have to do the program again. But they would tell you when you've applied, or just send an email. I work 2 days a week on site and 3 days a week at home. It's amazing. Another pathway called the urgent care practitioner. So you are not an advanced nurse practitioner again, like I said. Practitioners are healthcare professionals that have completed the history taking and physical assessments. They've completed minor illnesses and minor injuries. They used to be called emergency nurse practitioners, but in the recent years they changed the name to urgent care practitioners because medics we have, and they're not nurses, so it's not fair for them to it's not fair for the role to remain as emergency nurse practitioners because they're not nurses. So that's why it was changed to urgent care practitioner. So you don't have to finish your own master's enough for you to work as an urgent care practitioner, but at least they want you to have an injury, to have completed the injury module, because you're going to have seen a lot of patients with minor injuries. Like the name said, minor injuries. Anything that is too complicated is referred to the orthopedics or sent to A&E for further assessment. So employer is different. Every requirement is different. You need to just go on and search about the requirement for urgent care practitioner jobs. Before you apply for the courses, find out the type of jobs you want to do, the clinical settings where you want to work. Do you want to work at a GP practice? Do you want to work for 111? Do you want to work at an urgent care center? Depending on the settings where you want to work will determine what the requirements are. Because I don't know, I have an A&E background, I have urgent care background. So I work with a lot of these practitioners and I do speak to them, and those are the courses they completed to start working. You have to become an urgent care practitioner nurse based on the research I found online. Also, you can also be sponsored to become a nurse practitioner or urgent care practitioner by your employer. I self-funded because I wanted to self-fund, because I didn't want the restriction of when I finished the module, I'll have to work for a particular trust for certain, because I knew that I was going to be moving around. I literally moved from like an hour away from where I used to work for 6 years. So imagine I was sponsored by my employer. I would have to be going there every day. It's over an hour to get there every day until I finish the 2 years contract I have with them. So I didn't want to be restricted, and that's why I self-funded. But if you don't want to self-fund and you know you're going to be in that trust for a long time and you don't mind staying there for the next few years, then I would advise you to if you can apply for your employer to sponsor you to become a nurse practitioner or urgent care practitioner or advanced care. The requirement to work as an urgent care practitioner is if you have completed the minor injury module. Some employers might be willing to take you on because I have minor illness, I have my prescribing, and I have physical assessment module which I've completed. But obviously they will encourage me in the name, maybe they will say to me one of the requirements for the contract is in the next 6 months make sure you've completed the minor injury module. Like I said, I'm not sure. It depends on the employer. Whatever employer you want to work for, if you currently work for that employer, send the HR department an email, tell them what are the requirements, or if check the job requirements so that you can know what module to study, or you can, if you're going to self-fund or if the employer is going to sponsor you, within a year or a year and a half, you should have completed the urgent care practitioner pathway or the nurse practitioner pathway. It depends on you again and your circumstances. So guys, this brings me to the end of today's video. If I've left out any vital information, I'll leave it on the screen. And if you work as an urgent care practitioner, as a nurse practitioner, advanced clinical practitioner, you can always leave a comment in the comment section, and we can have a conversation about what it's like for you to work as a nurse practitioner in general. So guys, thank you so much for watching this video. Until next time, bye bye.